all the previous guidelines were about absolute value of blood pressure. But now you would actually see that the new variable in there, blood pressure variability or blood pressure fluctuation. And that is a variable that has been introduced in both intracerebral hemorrhage guidelines and ischemic stroke guidelines. So what is this blood pressure variability? So before we go into the history of blood pressure variability, does anybody know that when was the first time somebody actually measured a blood pressure? And if somebody knows the answer to that question, I'm going to ask the organizers to actually waive their fees for the next registration and the next meeting. So anybody knows when was the first blood pressure ever measured? I guess nobody's going to get that registration waiver. This is actually the history of blood pressure. And you can see it's an extensive history of blood pressure. But I just want to highlight historical pair. The first time somebody measured a blood pressure was in 1733. And it was measured on a horse. So a tube was put directly in the artery of the neck in the horse. And they didn't have any other way, so it was a fluid collimation. And they described two things. One was the absolute value of blood pressure, and second was the variability. And the next 200 years, everybody started focusing on the absolute number and forgot about the variability that was described in the first place.